So tonight, I just want to present our speaker, Matthew Browning, and he's going to talk to us on the health benefits of interacting with nature. I'm going to let Matthew just tell us a little bit about himself, okay?
Yeah, sounds good. Yeah, thank you, Bev. And thank you all for coming out on such a uncertain day, uncertain night. I really appreciate your glowing faces. This is going to be a lot of fun for me. I hope it's fun for you as well. So instead of just giving a little bit more about myself, I'm going to frame it within how I see the world, because I think our experience and our education really bias us in certain ways towards the type of work that we do and the type of and how we conduct it. So just to give you some idea that my background is actually in music. I started off in music, and so I try to use some musical phrases when I talk and when I write and things like that, and hopefully that'll come through. And then my graduate work is actually in resource management, and I worked as a park ranger for a number of years, but then also studied forestry as well. So I'm currently an environmental social scientist, but I have that grounding in the biological sciences, and you'll see that here in a second, because I think it's important to understand how ecology works when we're thinking about how that impacts us as people. And my spouse is also a landscape designer, and so she has taught me a lot about the aesthetics of the landscape and how to incorporate local plants, but then also plants that are easy to maintain and things like this. And these are all important when we're thinking about how nature impacts people and how we can manage those spaces for those benefits. My current position is in a Department of Recreation, Sport, and Tourism. I do hold an affiliate in the Natural Resources and Environmental Science Department, if you're familiar with that. And then we have a thriving research group called the Parks and Environmental Behavior Research Group that we do hold about 8 seminars every semester on campus that are open to the general public. And we do have a website, which I'm happy to provide a link to at the end of this talk. And then I'm also director of a virtual reality nature lab, so we actually look at simulations of nature and how that impacts people that don't have access to the outdoors. This is a beautiful picture from a recent documentary called Love Thy Nature, and it shows that we are really in this transactional relationship with nature. So it's not just we go out to a place and it provides us some benefits, or we go out to a place and engage in environmental stewardship or planting, and we're benefiting the environment. It's a really two-way street, and we really need to think of ourselves when we go out into a garden or into a park or into a forest as us responding to whatever the environment's giving us, and vice versa. And obviously we can see that with climate change very blatantly. We as a society are obviously impacting society or the environment, and now that's impacting us on a broader scale. Another thing that's happening globally that has driven my interest in nature and human health is that people that are tasked with managing our natural areas, including here in Illinois, are really asked to do more with less. So the average salaries of, for example, state park rangers has dropped by 12% in the last 10 years. Federal funding has obviously been cut, state funding has been cut, but then private land conservation and easements have been cut drastically, in part because we've lost the Land and Water Conservation Trust Fund, which is the major funding source for land easements and conservation federally. Simultaneously, there are a ton of things going on that are just demanding our attention and us understanding the relationship between humans and nature and humans. Some of those things obviously are deforestation that are hurting the wildlife and the fauna and the flora in, for example, rainforests, but then also that impacts the local livelihoods and the health of the people that are living there in more often than not in a negative way. Climate change I already mentioned before, and I have 2 young kids at home, and I think that many of us feel particularly scared about what this is going to look like for future generations, not just what we're going through now. And then with mass-produced agriculture and meat production, this is causing more frequent, for example, disease outbreaks in humans, but then also in those animals because they are much less resilient to infection. Simultaneously, there are increasing rates of disease and illness in our society. So it's estimated in the next 10 years that about half of us will have some chronic disease or illness, and less than 10% of us actually meet the federal guidelines for physical activity and fruit and vegetable consumption. Although, interestingly enough, you can see there on the left-hand side of the screen that about 60% of us report that we get enough physical exercise. So when we think about trying to support human health, we often look at traditional medicine, which has been wonderful for many things. An obvious example is thinking about going into surgery without anesthetic. I can't imagine what that would be like. But there are some limitations. Notably, it's treating the symptoms of a disease rather than an underlying cause. Case in point, I just learned that I had Lyme disease, which is very depressing for someone that loves the outdoors. But I had been treating for symptoms for a number of years without anybody identifying the underlying cause, because conventional medicine is set up around, again, symptom alleviation. It's also quite expensive. Year after year, including this year, unfortunately, pharmaceutical prices keep going up. There's obviously side effects of these. You become dependent on it. And there's insufficient attention brought to prevention of disease, promotion of health and well-being. So even though we are living longer, so our average lifespan is in the 80s now, that doesn't necessarily mean the quality of our life has gotten better for those extended years. And there are wide health disparities between people of affluence and people of color or low socioeconomic status. And this isn't really treated with a traditional approach to medicine. So one alternative sort of framework that people have used, which we can then apply to how to improve nature and at the same time we improve human health, is what's called social determinants of health. So you can see that about 40% of our health outcomes is driven by behavior, our own behavior, what we eat, how we exercise, sleep. 30% is driven by our genetics, but then 20% is driven by the environment we live in. And certainly that has to do with our friends and family. That's a big part of it, but it also has to do with our built and natural environment. So my line of research, it looks at applying findings on how nature impacts people and how people impact nature in order to inform how to produce more beautiful and health-promoting gardens and parks and forests and this sort of thing. And I like to use that the social determinants of health framework that I mentioned before, in part because traditionally this framework has had 5 little circles there, and then it has a 6th one just for the environment. And the environment is separated from the economy, healthcare, education, community, health and well-being. And in the research I'm about to show, the environment we live in actually impacts everything on this slide here. So the more we support a healthy, functioning ecosystem, and biophilic buildings and this sort of thing, the more we can have a positive economy, a sustainable and an equitable healthcare system, again, equitable education, community health, and then our own individual health and well-being. So just to give you an idea of the range of things that have been linked to prevalence of nature, this is from a study that was done in Europe where they retrieved the medical records of over 300,000 people and looked at the doctor diagnoses from those individuals, and then looked at how much nature was around each of their houses. And then they looked at the relative risk of any given person having one of these disease and illness. This is about 1/3 of the disease and illnesses that were identified as less likely to occur for people that lived in greener settings. And you can see that the percentage decreases are pretty substantial there. So in general, mental health seems to be particularly benefited by more nature around where we live. You can see anxiety and depression, a 44% decrease for the people in the lowest amount of greenness versus the people in the highest amount of greenness. And you can see a range of other diseases and illnesses there as well. And some of the pathways that people have identified that link nature exposure to our health are shown here. So, and I'm going to get into the theory behind this here in a little bit, but nature seems, green space, I can get into how we define nature later, but let's just say call it nature for now. It increases our attentional capacities. It also reduces our stress. It also allows for exposure to beneficial bacteria in the air that we breathe, in the soil that we garden with. It mitigates exposure to other sorts of environmental stressors like air pollution or extreme heat events. And then it promotes healthy behavior. So obviously physical exercise, but then also going out to natural areas with your friends and family, enjoying those activities. Even sleep seems to be improved by going outdoors beyond just the effects of going out in the morning, getting bright light, and getting melatonin. There seems to be more to it than that. So there is a wide range of theory. I'm not at all expecting anyone to read this. This table is more to serve of an example of all the different ways that people have thought about why these pathways exist. And a lot of people think about it in terms of our evolutionary history as a species. So we spent most of our time not in buildings like this, although nowadays we spend most of our lives in buildings like this. And people have debated what types of environments we grew up in, whether it's an African savanna type landscape, whether that savanna was dominated by this type of vegetation or that type of vegetation, whether we might have innate preferences for landscapes based off of how much they capture our awe and fascination, to what extent they allow us to visually explore the landscape. All of this these are not mutually exclusive. There's probably some compound effect of us being inclined towards forests, but then also forests that are not too dense that make us scared and like something's going to leap out at us. So there is some good, this is called evolutionary psychological theory, so applying sort of our evolutionary history to psychology and how we function. So the next part of the talk, I'm going to get into that model that I showed you before and show you some examples from our research labs, links between environmental health and abundance of nature, and each of these different components of community and individual health and well-being. So let me start with healthcare for a start. So you can see those 4 pathways there in the middle, and then green space again sort of contributes to all of those things. Socioeconomic status, so someone from a poor family is less likely to have health literacy and might not know the importance of physical activity or might not have access to safe places, so that can actually negatively impact health behaviors. And they also will be more likely to be exposed to things like air pollution, unfortunately. All of this will then relate to comorbidity, so the occurrence or more than one occurrence of a disease or illness, which ultimately relates to what extent we use a healthcare system. And that will ultimately relate to how much we spend there. So this is sort of our working model for why we think nature might actually reduce the amount that people have to go to the doctor throughout their lifespan. And we tested this with people that are using the Medicare system across the United States over multiple years. We are looking at the amount of dollars that they were claiming from the US government on an annual basis. And then we looked at the percentage of forest land, shrub land, and that has to be based on the height of a vegetation, grass, and we also looked at agriculture and cropland. And we found that the more forests and the more shrubs are in any given county, this was on a county scale, so Champaign County, the less people spent on healthcare every year. And you can see that the finding was statistically significant, and it was on an order of magnitude that would actually make a meaningful difference if, let's say, the whole United States decided to increase their forest cover by 10%. So we do seem to see this finding in this observational study. Now, if you apply those findings, we're now applying these findings to some working with urban foresters in the state of California. If you apply these to how much municipalities are spending on maintaining these forests, you actually find that there's a cost-benefit ratio of maintaining and developing these forests. So when you calculate the percentage of Medicare population in any given, in this case, these three California municipalities, by the percentage of tree cover that these places are maintaining, you get the average benefits on an annual basis, and then you can create a ratio between that benefit to the cost that each of these municipalities are using, and you're finding that for every, on average, a $1 investment in trees every year, it's associated with a $6.50 reduction in healthcare spending. So does anybody know how much we spend on average as, so every US citizen on average spends on healthcare each year?
Out of pocket?
No, not what you spend, but what the entirety spends. So per capita. Yep. So this is people age 18 and over. The average spending is about $10,000 per year. Every person. Now, obviously, the people that are more sickly are going to spend more, and people that are less sickly, and particularly younger, are going to spend less, but that is the average across age demographics. So you can see, you can make a strong argument for greening, and particularly planting trees, for reducing this quite amazing amount that we spend on healthcare. And I will say that during the Obama administration, although I haven't checked this for the Trump administration, we started spending more on Medicare and Medicaid services than we did on military spending the first time in our country's history. So the amount that we're spending as a country is quite astounding. So is it out of pocket? No. Is most of your taxes going to it? Yes. So the ramifications of these healthcare finding studies, there does seem to be this particular benefit for, or association, this is all observational research, for trees and shrubs. So not necessarily our grass lawns that are so beautiful, or our agricultural fields that are providing us with food, but there does seem to be this association with forests and trees. So what does this mean? Well, if you're trying to increase, I don't know, if you're thinking about, if you have your own land and you're thinking about conservation easements on it or something like that, and you want to benefit larger society, it seems like forests are particularly good at doing that. And then if you're, let's say, Champaign Park District, or if you're working for Urbana Park District, something like that, it does seem like tree canopy cover would be particularly beneficial for people. So moving on to economy, we have another observational study, so I will caveat that. I'll get into this experimental cause and effect relationship at the end of the talk. But we have this study looking at whether green space also improves children's social mobility. Now, what that means is their ability to go from growing up in poverty to earning a reasonable wage as an adult. And this is a huge issue because they are, it's very hard growing up in poverty to have the same access to education, but then also having the same support for advancing in higher orders of education than securing and maintaining jobs that are, again, are high paid. And so we built, again, this another model that explains how exposure to green space improves academic achievement, which we do see in both schools serving predominantly upper income majority white populations, but then also disadvantaged populations. How exposure to greenness also improves creativity. So there are some experiments, for example, you can show pictures of nature versus pictures of the city. You can also show blocks, color blocks that are the color green versus the color red and blue, and you can see increases in creativity, short-term increase in creativity. So that's promising. And then also there is, again, experimental research on exposure to urban green space, in particular, improving what's called emotional intelligence. So this is our ability to understand ourselves and how our actions will impact others, such that we can build, healthy relationships with others. Now, emotional intelligence is one of the main driving factors for people in management making really good salaries and their businesses being successful. So each one of these things would necessarily lead any student, one from poverty or not, to making a reasonable wage. And what we're doing is we're actually looking at this cohort of millennials that were born around 1980. And this data tracks them throughout their life. And then we separate out the children that were born in, I think, the lowest 15th percentage of nationwide income, and then look at how much they're earning today. And indeed, we are finding, this again, there's too much information on this table, I'll boil it down for you. We are finding again that the children that are growing up in this case, census tracts that are greener are making much better salaries than their peers who did not. Okay, so we looked at a few different things here. We are looking at overall greenness. So this measure is from a remote sensing satellite. That satellite goes around the Earth and is actually looking at the reflectivity of red and near infrared wavelengths. All that means is that it's measuring the amount of chlorophyll on the ground. It's not measuring anything other than that. It's literally measuring greenness, okay? So we can't differentiate types of greenness, qualities, or anything like that. So that's what the top three rows are. So basically the top row is, it's called the second quartile of greenness. It's less green. Q4 is the most green. Park proximity. So this is the number of people in any given census tract that are within a 10-minute walk of a park. And again, Q2 would be very low numbers. Q4 would be higher numbers. And then park acreage is how many acres are in any census tract that are publicly owned and green space. And interestingly, you see that there's a lot of green pluses. Those are good things. Those are positive associations between greener tracts and poor kids rising out of poverty. The red ones, interestingly, are the opposite. So now, this study was actually done in the 10 largest cities in the United States, including places like Detroit and Chicago. Park acreage in these places, oftentimes there are still quite large parks that are not maintained and are not very safe in lower income areas. And then there are newer, smaller, more scattered throughout, and therefore more accessible parks in places like northern Chicago. And so what we might be seeing is you can have these larger areas, but if they're not maintained well, then you might even be seeing a negative association because the kids aren't going out there. But again, you do seem to see this positive association between greener areas and kids growing out of poverty, and therefore that benefiting the economy. Moving on to education, I already got into this before. There are a number of different mechanisms I already put in there, and just to move more quickly through this, because I'm showing a lot of figures and tables, we did a systematic literature review of, this is a new field of research, of 13 studies that have looked at the association between greener neighborhoods and or greener schools and student standardized test scores, which is a major factor for how much money the schools get, what the teachers' salaries are, teacher retention, as well as student outcomes long-term, not just in that single year that they measure test scores. As well as not just math and reading standardized test scores, but then also what their end of the semester grades are and what their college preparatory exam grades are, like the ACT and SAT. And there's a bunch of zeros, pluses, and minuses here. If you look across this body of literature, there's a lot of null findings, which means that there wasn't a statistically significant relationship. Those are all the zeros. But there are a number of places that there are quite a few positive associations. In particular, it seems like, again, trees on the schoolyard, particularly when you can see them from the windows, you see a positive association. So do these places need to be physically accessible? We don't quite know yet. The best study was actually an experimental study in a college population where they randomly assigned students in a undergraduate writing course to a classroom that had a window of green space and windows where the windows were fogged over so you couldn't see anything. And the students were earning about 1 letter grade higher in the green window classroom, holding everything else constant. So the implications for this, there does seem to be this benefit of greenness immediately around the schools, that would contribute to our educational system and our educational disparities. And again, I mentioned before, a number of these studies, including some that we've conducted in Chicago, are finding this does benefit disadvantaged schools, because if anybody knows the Chicago public school system, it's over 85, it might even be 90% non-white and free and reduced lunch eligible students that are going to those public schools. One thing many of us that care about is educating children, but then also adults, about nature at places like nature centers or community gardens, botanical gardens. And so we conducted this study of some of the best nature centers as deemed by a number of different professional organizations across the United States and Canada. And we are looking at seeing if these places are holding community value, if they contribute to community health and well-being beyond just teaching people about nature. And so we ended up surveying about 200,000 people across the country around 16 nature centers. And we did find that there were actually, the relevant information here are these 4 column headers that say leisure provision, environmental connection, civic engagement, community resilience. We actually found that there are these 4 sort of groupings that you can think about the benefit of, groups like the Illinois Extension having facilities or having programs for communities. And it includes building environmental connection, so teaching environmental literacy and encouraging pro-environmental behavior. But it also is providing leisure and recreation and physical activity. It's also actually engaging civic organizations. So some facilities, for example, will, just like some churches around here, will also serve as local election voting facilities. So people that aren't aware that they exist go there, and then they think, oh, I should come back here and I should go for a hike, or I should learn about Illinois farming, this sort of thing. And then they also actually build up resilience in a community by integrating people from different walks of life and building that sense of place. And so we are finding that, again, green spaces, and particularly these sort of educational green spaces, do contribute in a number of ways to community health and well-being. Does anyone know the large lot program in Chicago going on? So there are a number of vacant lots that no longer have buildings on them that might be owned privately, they might be owned by the city, but nothing is going on there, such that they are not very aesthetic, they're unsafe, they're often in neighborhoods that are in need of repair. And so the city of Chicago is buying these and selling them to local residents for $1 if you live on that street. And this has been going on a couple years, and colleagues and myself are measuring both individual and societal impacts of this program. And one of the things we're finding is that the crime on these streets are greatly reduced. And one possible mechanism might be what's called the broken window theory from criminology, whereby if you see a place that has broken windows, you're more likely to treat it without respect and break windows yourself if you're a teenager. Or a better example might be if you're walking by a trash bin and it's overflowing with garbage, you might not go to a lot of effort to make sure your trash actually gets in the trash bin. You might just put it on the mound next to it because everyone else is just doing it. It's the norm set up. So when people take ownership over these lots and they start to maintain this one little spot they got for $1, then other people might start maintaining their streetscapes as well. Or if they have a lot themselves that they've never done anything with, they might, well, say, let's plant something here and maintain it as well. So there are these benefits, and particularly in regard to engaging local community members. It does seem like it's important when you're thinking about nature and health to not have it sort of as a top-down approach, and I'm going to come in and I'm going to invest in this green space. It does seem to need to come from the bottom up and engage in the community, which you all know very well. I'm going to talk about just a few exciting direct relationships between nature and health. So we were sort of looking at all these different aspects of health, but let's get into the nitty-gritty of health. And since many of us love gardening, so here's one cool finding we're having. There seems to be a relationship between gardeners and non-gardeners and how healthy their gut is. Now, if you haven't seen the news about the microbiome, it's become this very hot topic in science. In fact, there's more bacteria in each of our bodies than there are human cells. So we are more bacteria than we are people. And the bacteria in our gut, particularly the large intestine, seems to be a major driver of what's going on in our head and how we feel. So many of the neurotransmitters are actually produced in our gut and then brought up to the head. Obviously, they regulate our digestion. So if we have digestive issues, a lot of that's dictated by our gut microbiome. But then it also regulates our immune system, so our ability to ward off infection and disease. There's many what are called autoimmune disorders, everything from MS to diabetes. And these, again, are driven by what's going on in the gut. So the fact that the green bars in two of these three beneficial bacteria colonies are higher for gardeners versus non-gardeners, which are the red bar, is very exciting. This is again, correlational evidence that we collected from actually a survey of Champaign-Urbana. But right now we're running a study with, I think it's 10 gardening families and 10 non-gardening families over time. And we're looking at whether the frequency of gardening over this past season will influence, again, what's going on in their guts. So you can think about maybe not being super diligent with wearing your gardening gloves all the time, or maybe you don't have to be so concerned about washing your produce afterwards, because a lot of that bacteria is in the soil. There's a very high correlation between healthy bacteria in the soil and healthy bacteria in the gut. Another thing that we're finding is what's called volatile organic compounds or chemicals are lower in greener settings. Now, these are things that are produced when we manufacture things like plastics and rubbers. There are also things that are given off when we put down new carpet and new paint on the walls. So they are all around us. They are part of growing up in a built environment. However, in particular, trees seem to be good at absorbing these things such that they are not in our bodies. So this was a study that is ongoing at University of Louisville, in Louisville, Kentucky. Again, this is a correlational evidence, although we're doing an experiment, which I'll talk about in a second, where we measured, we had people pee in a glass, and then we measured the frequency of about I think it's about 50 of these VOCs, so these toxic chemicals in their bloodstreams. And I'm just highlighting a few different ones here that are lower. You can see they're negative, and they have a little star next to them, which means there's a statistically significant negative association between the frequency of these toxic things in our bodies and how much green space is around us. And the two columns there, you can see it's 100 meters versus 250 meters. And I forgot to mention this earlier, but we do seem to see a drop-off effect based off how far away the green space is from where we live. So the closer it is to where our house is in particular, seems to have more benefit. Here's another example. We did a study with 12,000 nursing homes across the country, looking again at green space on the property that the nursing home manages and rates of depression in the residents. Now, it's interesting with people that are in an assisted care facility, many of them cannot get outside, and so the only way they're benefiting, you might think at least, is from views of windows. Well, this air quality measure might actually be important too. So if you live within, I'm not going to give an exact distance because I don't remember offhand, but you can live next to a freeway and still have very poor indoor air quality. You don't have to go outside to be exposed to everything that's being left off by the trucks. And so, again, if you are in a nursing home, you can still benefit from a green space nearby just by this simple mechanism of filtering out the air. And then obviously there's the benefit of the greenspace views as well. So that's all to emphasize the importance for green space near the home. That seems to be a very strong benefit. Let me briefly mention what we're doing with virtual nature. So this is a contentious issue, I think, because if we find that putting on this headset right here, which are actually pretty inexpensive, that headset is $30, and that's just someone's smartphone in there. And these things are actually quite immersive. But if we find that people really like going into nature and they get similar benefits when they put on one of these headsets as actually sitting outside, maybe nobody will go outside anymore and actually garden and go out to parks. We don't want that. However, if I have to go into surgery, or as I'm going to for Lyme disease, does anybody know anyone that's had Lyme disease here? Oh, wow.
Recently. Does it last forever?
It's debatable. You probably have read it's a political disease. Like doctors have lost their licenses because the standard course of treatment is 2 weeks of antibiotics.
Yeah, I don't know if that's good enough.
No, it's not. But so what some people respond to really well is 3 hours every day for a month of IV treatments. So if I have to do something like that, I would love to go explore national parks, right? Similarly, if I'm in an assisted care facility and I don't have a window view, I certainly want to be visiting these places. There's a whole range of places that this would be appropriate for. And so again, in this lab that I'm running, we're this is justifying 93% of our time. Maybe not for everyone in this room, but across the country, that's the estimate. And then, of course, globally, we are living in a very urbanized society. About 80% of us are living in a metropolitan area now. So we ran one study. We're saying 2 studies now. We're doing another one this spring where we're testing the benefit of this virtual nature experience versus a real outdoor nature experience. And we are finding that, at least in terms of how people feel, their positive affects, so their positive moods, happiness, we do seem to find that going outdoors or going into this virtual setting improves their positive affect equally well. That's why you can see VR nature treatment, real nature treatment, those are equally good compared to just sitting inside and not having any nature treatment at all. What we're doing this spring, launching in just a couple weeks, is we're actually recruiting students that are depressed or anxious and having them do this every day for a month. Now this is a totally different thing because our previous experiment is you just do this for an afternoon, right? And I can imagine, well, this might be novel and exciting and beautiful one time, but are people really going to do it for a month? Well, maybe they would do it more, particularly with weather like this. So we're going to find that out. What's that? Yeah, it's a really good question. So we measured for people's preferences toward nature. Disgust sensitivity had to do with to what extent they were revolted by getting muddy, by getting bugs on their skin, by brushing against plants. Engagement with beauty was when you ask people about what's beautiful in the world, whether they immediately start talking about nature versus art and music and drama and athletic performance. Good question. One interesting thing I have not gotten into here at all is what's called a dose response curve. And so if you think about if you have to take a medication, you get 1 pill or 3 pills or whatever you get, and you have to take it at a certain amount of frequency, and within that pill there's a certain amount of the drug. Now you can think about that with nature too. So what is the dose response for nature? Do we have to go out every day? Do we have to go out for 5 minutes or an hour? Do we have to have at least one wilderness experience every year to really get away from it all? And we have no idea. I mean, this literature is quite new. So you could see that there might be, just ignore the bottom graph right there. You can see it might be a linear thing where you can have very limited experience and get very little benefit, but then very high experience with nature. In the summertime, many of us are going outside regularly, and it might be that linear curve. But you could also imagine that there might actually be a drop-off with, and I hate to say this, but things like infectious disease, or you could think about sunburn. So with physical activity, I don't do this, but some of my friends are quite intense with physical activity. This is what the health benefit curve looks like for physical activity. So going to CrossFit every day and running ultramarathons every day, you see a decline in longevity, right? So there might be some sort of optimal functioning for how frequent and how often, how frequent, how long, and then the types of nature that you go out to. And this is one of the things that I want to get into my future research, is sort of informing people that are trying to incorporate nature into their everyday lives, how often they need to go out and how long. And this will probably vary on the outcome that you're looking at. So if you're really interested in improving your mental health, that might be very different than reducing your risk for cardiovascular disease, because those mechanisms probably are slightly different. And then I'll just end with this other thing here that's an important caveat in any science you do. There's a difference between what's statistically significant and what's clinically meaningful. And I will be the first to admit that a lot of the slides I put up there that had the little stars by them, that could be publishable research, but that doesn't mean that if everyone in this room went outside if everyone in this room put on that headset that I was showing earlier, that everyone would feel happier, right? There's individual differences for us all, and the increase in happiness might be so small that we wouldn't actually feel it. And so it's really important also to apply what we're researching to actually real-world settings and seeing if they have a real impact in each and every one of us. So that's another direction that we're hoping to move. And with that, I'm going to remind us that nature can be beautiful in the winter, particularly if we get to travel to places like this. And I will open it up for questions. Thanks for your attention.
I'm curious. I frequently see people who are walking, they're out in nature, but they're on their iPhone. Have you studied any thing about this? Is it important that when you're in nature, that you're really in nature, as opposed to physically being out of doors but oblivious to what's around you?
So one study that comes to mind is for through hikers, so people that are walking long distances on places like the Appalachian Trail. And that does seem to negatively impact what they get out of it, both health and satisfaction, because it allows them to, it doesn't allow them to be present where they're at, and they're constantly, what they're doing is not necessarily just Instagramming and Facebooking, they're constantly looking at the next spot that they're going to. And so they're not ever, it's less likely that they're enjoying themselves along the way. So it's much more about, I'm going to get to this destination, and then with our short-term memory, oh, well, what's the next one we're going to go to? So they keep checking them. So there is some research on people that are more in wilderness settings on that. There is a debate, I will say, there is a debate in park management on whether we should promote technology or whether we should try to keep it out of these places. The obvious argument for promoting it is that there are some populations that may not go out there at all unless you supplement with technologically enhanced experience, like this Pokemon Go phenomenon that has already died off. My research hasn't explicitly looked at that. I would say that, as I showed up there, there are benefits of nature that you don't have to pay attention to, but we don't, such as breathing healthier air. But we don't know which of those mechanisms have bigger effects, and again, for bigger outcomes. I would say that the short-term benefits, like attention and mood and stress reduction, are more likely to be facilitated by us being aware of our settings, whereas those longer-term things, like reduced toxic exposure, are probably more long-term things, because these are, these are building up in our bodies and causing inflammation, and therefore increasing the risk of our disease and illness. So it depends on what you're interested in. Great question.
early on you showed a chart that seemed to suggest that trees and shrubs had a significant positive benefit, grasses didn't.
Yeah.
Has anybody looked at the benefits of being outdoors in the middle western part of the country, Kansas, Dakotas, and so on and so forth, where there aren't many trees?
It's a really good question. Most of this literature is done in cities. That's the first thing I'll say. Also, most of it is done in the developed world. Few studies have looked at places across an urban and a rural gradient, and even fewer have included rural areas that are not forested, like the Northeast. We have done some nationwide studies, and those are the studies I reflected there. So when we're not finding a relationship with grass or agriculture and crops, that is reflected on a nationwide study. But I think that looking just within, for example, Illinois, would be quite interesting. And no, it hasn't been done. That I know of. It's always amazing. It probably has been done. I'm not aware of it. Yeah, thanks.
I don't need Mike. What parks in Utah were you a ranger at? I'm just curious.
So the Southeast, Southeast Utah group. So Arches, Canyonlands, there's a cluster of parks right there. It's awesome. And then I was in North Carolina at a number of parks, including Mount Mitchell, which is the highest peak east of the Mississippi. Many people don't know of it, but it's higher than Mount Washington, which many people know of in New Hampshire. And I lived right on the top. It's a perfect thing to do in your early 20s. Yeah.
Is that GPS verified?
It's bona fide.
It is higher in elevation.
It's bona fide. Yeah, it's about I think 50 feet higher than Mount Washington. Although Mount Washington, we had extreme weather. Mount Washington is a whole nother world. Yeah.
Thank you.
Yeah.
So I have a question going back to the economic cost. I think it's great that you try to put an economic value on trees, because we all try to do that with science, water, whatever we're studying.
Sure.
But I was the $1 for $6.50 return on investment.
Yeah.
What was that? And so I'm trying to understand that again. It was just all the Medicare costs compared to the cost of maintaining trees by arborists?
Yeah. So it was the latter of what you said was correct. So looking at how many trees and the tree coverage in these municipalities. So we're just looking at public trees, not private trees. How much that is costing this municipality. And looking at that cost on an annual basis compared to what I was showing before, there's this relationship between Medicare spending per person every year and how much forest is in the area that they live. So it's applying that coefficient to the number of Medicare beneficiaries in that city and presuming that they would benefit equally for our nationwide study, and then looking at that ratio.
And so that's older adults.
It is our older adults. So we have a study right now with 4 million subscribers to Kaiser Permanente health insurance in California. That's why the study's in health insurance in California. On individual level data, so we have every year for 15 years how much 4 million people across from 0 to death have spent. And we are looking across the lifespan and hope to have those in the next year or two. Yeah. Yep.
I'm asking what kind of funding
Yeah.
supports your research?
So I will first say the National Advisory Council for, National Urban and Community Forestry Advisor Council, which is an advisory council of professionals that informs the U.S. Forest Service on how to divvy up research funding, has funded us, and they have funded many of these studies in the past. It's called NUCFAC is the acronym. So I first want to put that out there. But increasingly, there are other federal funders. So we have funds with the National Institute of Health, which are starting to realize, particularly with this air pollution research, that the national environment impacts our health. And then there's other foundations and smaller pots of money, but on a federal level, those are the U.S. Forest Service has been the traditional funder. Yeah.
Well, I'll just put in my 2 cents worth, because as I traveled around the country and I've seen all these big cities, it seems like Central Park in New York City, and so many of the big cities, they have beautiful parks.
Mm-hmm.
And I really feel like those beautiful parks in all our different cities have made such a difference in people that dwell in those cities, and how they're going to come out both health-wise and economical. And then when I was always thinking about when you buy a house, and you look, okay, let's see what kind of trees are around it. You don't look like, oh, we've got a vacant lot here and we've got so there you go.
Yeah,
It's just
great
like
point.
that's where your attention span is, and how your health and your well-being is going to be from what you see around you. Mitzi?
Would you say that if there isn't a line of trees or cluster of trees or mini forest in an urban place because of space, would a botanical garden be of equally as helpful for health? Or
That's a good question.
would that be, well, often botanical gardens will have more like a green, tropical kind of environment, so it'll be indoors, many of them, and then plants are displayed, and it's not quite the natural environment. But I'd like to know the worth of that if the other couldn't be a possibility.
Yeah. So those settings, the one limitation, I guess, of those is that their benefits are really going to be contained to that biosphere, because they have to be so closely regulated, right? And so they probably are not impacting the broader neighborhood, with the exception of people that are going there. I don't know much about it. I have to think more about it, but that's my initial response. Yeah.
So in our neighborhood, we live near Morrissey Park, and I don't know how many years ago they put in a sidewalk in that park. And has there been any studies on like the community satisfaction? Because there's so many more people using that park since they put there's dog walkers, runners, strollers. You just get through the whole park, and it's, I would say that the community surrounding it has really, really benefited it. That would be I think they should be putting sidewalks in a lot of these parks.
Yeah, that speaks really well to defining what we're talking about with nature. So there are, for example, Trust for Public Land that has funded and maintains quite a bit of protected area across the country. They have this big initiative to ensure that everyone lives within 10-minute walk of a park, but they actually have different ways of defining park to look not just on presence or absence, but amenities within that park. Funding per capita for the park system that the park's part of. So you can imagine a park. There might be a lot of parks, but the per capita spending is really low, so they're probably really poorly maintained. And what is it? Amenities, investments, and I think the third is access. But so people have started to research those qualities, particularly within park systems. And we've done some of that research ourselves. I'm not recalling the results, but yes, no, anecdotally, no, I know that it is very important. And that, again, it speaks to what I was mentioning before, the being responsive to your community needs seems to have a much bigger impact than just this top-down approach of, well, let's plant this park here and we don't really care if anybody uses it type of thing. Yeah, good.
I was
I'm wondering, because the rural areas are continuing to empty out as if
Yeah.
they have such a low quality of life. And one of the things
Yeah.
I've wondered, I mean, there's so many problems in rural areas too. There's more drug addiction and some health problems and so on, which seems very counterintuitive because there they are in all this green space.
Yeah.
And so one of the things I'm wondering is there any movement towards maybe, is education what's lacking? It's a little bit hard to understand why the beneficial effects don't seem to be apparent in rural areas, and in fact everyone's fleeing to the cities worldwide.
So this responds to the gentleman's question earlier. I'm wondering if there might not be more research that is across the urban-rural gradient because rural areas are so confusing. And that's something that we are wanting to address directly. In regards to why rural areas have poorer health quality in general, regardless of their environment, Laura Payne, who's in my department, is a great resource for that, and she's part of Extension, or was. But my understanding is that major barriers are access to health care and low health literacy. And then there's a number of other things as well. So you can live out in rural settings and live right next to a cornfield but have no access to high quality food, for example. But my understanding, those are two major drivers. And as beneficial as nature is, there are many things, as I showed in that sort of percentage of things that dictate our health, that trump the environment, right? Our genetics and our individual behavior seem to play a much bigger role. Now, that's not to say that the environment doesn't influence our epigenetics or doesn't influence our behavior, but those things are, if you live in a certain setting, you have to resolve those even regardless of your environment, it seems like, yeah. But I often think about that when my wife used to work a lot in coal mining country in West Virginia and Kentucky, and very narrow, sharp mountain valleys, but very beautiful in a way, but very, very, very unhealthy populations. The greatest, I think it's either the greatest prevalence of obesity, I think it's obesity is the highest in that area, and 90% tree cover, so yeah. Mm-hmm. Yeah. Yep. Very low, very, very little accessible public land, though. There's national forests in that area, but where people are actually living, very little public land, a lot of private land that doesn't have any access. Yeah.
All right, well, once again, thank you.
Thank you.
Very much.
Yeah. Thanks again for your attention. Yeah.